Coronary Artery Disease by Chelsea Hartigan. The student will be able to understand the following about coronary artery disease after this PowerPoint: the pathophysiology, etiology, clinical manifestations, laboratory findings, and medications and their side effects. So what is coronary artery disease? So coronary artery disease is the primary cause of heart disease in the United States. It diminishes the blood supply that affects the heart and causes ischemia. This persistent ischemia, or complete blockage of the coronary artery, can lead to a myocardial infarction, also known as a heart attack. Coronary artery disease accounts for 1 in 7 deaths in the United States. Now we're going to talk a little bit about arteriosclerosis versus atherosclerosis, whereas coronary artery disease caused by atherosclerosis is the primary cause of coronary artery disease. So arteriosclerosis is just the thickening or hardening of the arterial wall. This is just normal and happens with aging. Atherosclerosis is a form of arteriosclerosis in which plaque forms within the arterial wall. So next we will discuss the pathophysiology of atherosclerosis on the next slide. When we have injury to the endothelial cells in the arteries, that can be caused by many different risk factors, some we are going to talk about in a few minutes. The injured tissues become inflamed, which causes a decrease in the production of antithrombic and vasodilating cytokines, and also an increase in adhesion molecules. These adhesion molecules bind macrophages, which cause further destruction to the vessel wall. The macrophages also promote growth factors for smooth muscle cell growth. These cells form a fibrous plaque. The fibrous plaque may calcify, protrude into the vessel lumen, and obstruct blood flow to distal tissues, which may cause symptoms. Here I have a picture of a normal artery compared to a buildup of plaque versus an artery that is blocked with fat. So the first artery is, like I said, a normal artery with normal blood flow. The second one shows what plaque buildup looks like in the arterial walls. And the third one is what it looks like when we start forming blood clots due to that fat blocking the artery. So what is the etiology of coronary artery disease? We have different modifiable versus non-modifiable risk factors that I want to talk about very briefly. Modifiable risk factors are health-related factors that can be changed through lifestyle changes, such as diet or exercise, to prevent the likelihood of an illness occurring. We have non-modifiable risk factors, which are risk factors that cannot be changed through any intervention. So this is going to include our age, our gender, genetics, and race. First risk factor I want to talk about includes dyslipidemia. So this is the abnormal concentration of lipoproteins in the blood that increase your risk for coronary artery disease. If we have high levels of total cholesterol levels and high levels of LDL or low density lipoprotein, which is our bad cholesterol, that is not good. If we also have low levels of high density lipoprotein or HDL, that can show a strong indicator of coronary risk. Cigarette smoking is also a risk factor. Obesity is a risk factor. Hypertension is a risk factor because it contributes to that endothelial injury that causes that atherosclerosis. Diabetes is a risk factor as well because diabetes and insulin resistance cause damage to the endothelium, thickening of the vessel wall, and can increase that inflammation. Also, an atherogenic diet, which is a diet that is high in salt, fats, trans fats, and carbs, is also a risk factor for coronary artery disease. So pretty much all the good stuff we like to eat can increase our risk for coronary artery disease. Our clinical manifestations include chest pain, cold sweats, dizziness, lightheadedness, neck pain, and shortness of breath. These clinical manifestations usually present with symptoms and signs that result from inadequate perfusion to the tissues. So we see somebody come in, what are we going to do and ask them and talk about with them to see if they have coronary artery disease? So we're going to ask about their health history. So do they have diabetes? Do they have hypertension? Are they obese? Have they had any symptoms of ischemia? So that's shortness of breath, chest pain, dizziness as well. We're going to monitor their blood pressure. So as we know, hypertension increases the risk of developing coronary artery disease, so we're going to monitor that very closely. We're also going to palpate pulses in all major sites of the body. So palpating those pulses can show if there's a decreased blood flow to the extremities, resulting in possible peripheral artery disease, which causes an increased risk for coronary artery disease. We're going to assess for prolonged capillary refill. So we want to check to see if that capillary refill is prolonged because the heart may not be pumping enough blood to meet its needs, the body's needs. And then we're also going to assess for arterial bruits. Our lab findings are going to mostly include checking for our lipid levels. So this includes cholesterol and triglycerides. So the total cholesterol level needs to be below 200 milligrams per deciliter. Our triglycerides need to remain below 150 milligrams per deciliter. We're also going to check for our LDL, or our low density lipoprotein levels, and also our high density lipoprotein as well. Our LDL, we want to be able to keep below 100 because this is responsible for delivery of cholesterol to the tissue. So like I said, we want to keep that low number. Our HDL is responsible for reverse cholesterol transport, which returns excess cholesterol from the tissues to the liver for processing or elimination in the bile. So we want to make sure to keep that over 60. So that's our good cholesterol level. We also want to check for blood glucose to ensure diabetes is not present, which causes a higher risk for coronary artery disease. And last, we might also check for high sensitivity C-reactive protein that's used to assess the risks of future cardiovascular events such as heart attack and stroke. Elevated hsCRP levels may indicate subclinical inflammation, which can contribute to the development of atherosclerosis, which is our hardening of the arteries. So here are some medications that we may use to help prevent coronary artery disease. We want to make sure that our patients adhere to their regular medications because it can decrease the chance of a heart attack, heart disease, or stroke. First, we're going to talk about antiplatelet medications. So this is our aspirin and clopidogrel, also known as Plavix. We want to help ensure platelets do not clump together quickly to form blood clots. Some side effects of these medications include bleeding more easily, stomach ulcers, and gastric bleeding. Our statin drugs, such as atorvastatin, lovastatin, pravastatin, and simvastatin, help lower cholesterol levels and protect the blood vessel walls. So side effects of those might include muscle pain, headaches, nausea, and flushing. And then last, we're going to talk about our beta blockers. So that's metoprolol, labetalol, and atenolol. So these help lower the heart rate, which decreases the workload of the heart, and they might also lower blood pressure, because remember, hypertension can increase our risk for coronary artery disease. So in summary, coronary artery disease is primarily caused by atherosclerosis. Dyslipidemia and hypertension are going to be major risk factors. Common manifestations include chest pain, cold sweats, and dizziness. We want to make sure our patients adhere to their medications because that's very important. And then our goal is to make sure these patients have a heart-healthy diet. They also exercise. Those are our modifiable risk factors, and we want to make sure that they can do that. If they're already diagnosed, they still need to take their medications, have a good diet, and also try to exercise. So here I have a question regarding coronary artery disease. So a nurse is caring for a 64-year-old patient recently diagnosed with coronary artery disease. The patient asks, "What exactly is happening to my heart? Which of the following responses by the nurse best explains this disease process?" So the answer is C. The blood vessels that supply your heart are narrowed by fatty deposits, reducing blood flow. So we know coronary artery disease is caused by atherosclerosis, a buildup of lipid plaques and fibrous tissue in the coronary arteries. This narrowing and stiffening of the arteries reduce oxygen-rich blood flow to the myocardium, which can lead to ischemia, angina, heart attack, or heart failure. Option A describes conduction disorders such as arrhythmias. Option B describes valvular heart disease, and option D describes pericarditis. And here are my references.